Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service and Multicultural New South Wales. We're so happy that you've joined us again this afternoon. We have with us today, of course, our Senior Medical Advisor, Dr. Jan Fizzell, to give us updates on public health information and COVID-19. And we're so pleased to have as our special guest, we've seen her before here in our Multicultural Media Forums, we have Dr. Marianne Gale, Director of Population and Community Health at Southeastern Sydney Local Health District, to tell us all about Sydney WorldPride. How are you today?
Very well, thank you, Jess.
Thank you for joining us. Before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present, and also acknowledge Aboriginal colleagues and community members who may be joining us today. We also pay respects to elders and multicultural leaders who are in this session for this afternoon. We are joining you from the land of the Camaragal people. Now, we'll start, but before that, we'd like to remind you to please keep your microphones on mute. Please, as you know, we have 30 minutes to answer your questions, where Dr. Gale and Dr. Jan will make sure that they are able to provide information and answer your questions. But please, we want a lively discussion, so add your questions on the chat, and our colleagues will be also putting some links to resources for you. Shall we start? Dr. Jan, lots of information on COVID, or how are we going with the booster messages that we've had last 2 weeks ago, and some more updates?
Yeah, so I think the thing is, in New South Wales at the moment, we've got relatively lower COVID activity, which is not the same as no COVID activity. It's still quite possible to catch COVID when we're out and about. So it's still, it's worthwhile, particularly if we're going to events where the public transport's crowded, or if we're in a crowded venue, thinking about wearing a mask. And the key thing is, of course, now the COVID booster vaccines are available from pharmacists and GPs across the state. It's recommended that people aged 65 and over do go and get a COVID booster, no matter how many doses you've had in the past, as long as the previous dose that you had was 6 months ago, or you haven't had COVID in the past 6 months. It's worth waiting till you've had 6 months between your last infection or your last booster. The other thing is, of course, if you're 18 to 64 and you have other health conditions that put you at more serious risk of COVID, so lung complaints, your immune system doesn't work all that well, or you've got a disability, or you live in a congregate care environment with that disability, really important that you do get that booster. People should also think about getting the booster, particularly if they're travelling overseas, and that's everybody over the age of 18, and children, adolescents age 5 to 17 who've got medical comorbidities. Talk to your GP or paediatrician about whether your child needs a booster vaccine to keep them safe. It's recommended that we get those boosters in by June, but the sooner in some ways, the better, but also we've got new vaccines coming out in the next few weeks. So again, talk to your GP about whether it's better to get done now or in a couple of weeks' time. But the key thing is, do get those boosters in by June.
Thank you so much, Dr. Jan. And Dr. Gale, it's an exciting time. We have a lot of activities happening for Sydney WorldPride, and this is a time to celebrate.
Thanks, Jess. Yeah, absolutely. It's a very exciting time currently here in Sydney as we host WorldPride 2023. And it's a fantastic opportunity over the next couple of weeks to celebrate with the LGBTI community for this great event. And I believe there's more than 300 events occurring across Sydney. And we certainly look forward to participating in that and encourage everybody to get out and participate in those events. From New South Wales health perspective, we really want people to enjoy themselves, but to protect themselves as well and stay healthy and well during this period. And there's a number of things that people can do to ensure that that's the case. Firstly, for anybody who needs urgent medical care during this period, we strongly encourage you to come forward and seek that care. If you have a life-threatening illness, you feel very unwell, then we do encourage you to come to one of our emergency departments or to call 000. If you don't have a severe illness or a life-threatening emergency, there are many other health services that you can access for your health needs, and they include general practices, pharmacies, our public sexual health clinics, some dedicated clinics just for WorldPride called prevention hubs that are available there to you. And there's also services available via telephone, such as Health Direct or our sexual health info link number. And that's particularly if you've got any sexual health concerns, you can call that number and they can help you out. A number of those services are freely available to everybody, including people who've travelled from overseas. And that includes from our public sexual health clinics and prevention hubs. If you need a Mpox vaccine, if you haven't already been vaccinated, that's freely available to you, including for our international visitors. So please do come and see us. Or if you need testing for any STIs, again, those services are freely available to you. Please call the number, the sexual health info link number, or come to one of our clinics and our staff are there to help you out. So for whatever your health needs are during this period, including for interstate and international visitors, our health services are there to support you. And we do want you to come and seek help when you need it.
Thank you so much, Dr. Gale. And that number, which is Dr. Gale is mentioning, is the New South Wales Sexual Health Info line on 1-800-451-624. That's 1-800-451-624. And that's on the link. And I think this is a great celebration. Many communities, families, friends are going to be coming in, and that's happening in the weekend also for Mardi Gras. What's advice in terms of COVID and having, you've said that for monkeypox, but in terms of being safe, should we still always consider the rat test, and also if there's a need for PCR before we attend these events?
Do you want to go, Jan?
Yeah. So look, I think if you've got any symptoms of upper respiratory tract infection, or if you're not well, then it is a good idea to stay home, because if you're out and about in crowds, you can often give things to other people. If you have had people around you with COVID and you're wondering about going out, then, a rat test could help you feel a bit reassured that you're not brewing it, as it were. We do recommend that if people are immunosuppressed, that if they're going to need antiviral treatment for their COVID, that a PCR test, which is widely available in Sydney, is a good thing to access. But we do know in some rural areas that accessing PCR can be a little bit more tricky. And so using a rat test, and perhaps using more than one rat test. So do a test, wait a few hours. If you're still not feeling great, do another test. And that's usually okay if you've got those symptoms. But the key thing is if you've got people around you with COVID and you get symptoms of COVID, there's a very good chance you've got COVID and no one wants it, because it's still a serious illness. Even when we've been vaccinated, we do know that some people can still get unwell, and we do have other people out there who haven't been vaccinated who can get quite sick.
Thank you, Dr. Jan. And Dr. Gale, we've launched this, I think last week, Sydney WorldPride. It's a great international event. How important is it for people to embrace events like these, and also to understand the importance of activities like these?
Oh, thanks, Jess. Yeah, look, it is really important. And we know that, Sydney is a wonderfully diverse and inclusive city, and that includes for our LGBTIQ plus community. And, we really encourage everyone in the community to get out and support these events and support the LGBTI community, and to learn as well. I think for all of us, we're constantly learning and seeking to understand each other better, and appreciate the diversity that we have here in this great city. We know that for many people, including for many in the LGBTI community, that unfortunately stigma and discrimination still exists. And we know that that is harmful to our health. We know that that can lead to mental health distress, to physical health problems. And so, actually coming out in support and really addressing stigma and discrimination is very important, including from a health perspective. And so, this is an important time, I think, to affirm that great sense of diversity and inclusion, and that sense of being welcome in this great city of Sydney for everybody, whoever they are and for whatever background they come from. And that's really important. And as our health services, we're here to support people in a confidential manner, in a non-judgmental manner. And if anybody needs support for their health issues during this period, please come to our New South Wales Health Services or call one of those phone lines that we just provided the information for and that's available in the chat. And there will be health professionals there available to support you. And that includes if you need any mental health support during this period, because we can understand that while it's a period of celebration and joy, for some people as well, it can bring up some difficult issues and some emotions that can be upsetting. And so there are mental health supports as well available for anybody, and those resources are there available. And as well, resources are available in a number of languages, and those resources can be posted in the chat as well, so that if you need information about mental health supports or sexual health information or MPOX or COVID, all of that information is available in multiple languages on the New South Wales Health website. And as well, there are translation interpreter services available if you need to talk to a health professional and you're not confident in English. So please don't hesitate to come forward and seek help. Our services are there to assist you.
Thank you, Dr. Gale. And you mentioned about multicultural, information lines for mental health support. And we had exactly that. We talked about that in Transcultural Mental Health Line 2 weeks ago, last fortnight. And aside from that, there's distressing news happening around the world. There's a chance to celebrate, but also with what's happening, natural disasters happening across the world, just like in Turkey and Syria. Dr. Jan, there are some resources that have been developed.
Yeah, absolutely. So we know that we've got people who have friends and family in New Zealand, people who've got friends and family, colleagues in Turkey and Syria, who are being impacted by these events that have been occurring. One of the things that we learned a lot through COVID was the fact that when people are constantly being exposed to the same news, especially when they've had a distressing event in their own circle of friends or family, that, even just turning on the television or, opening your phone and scrolling the news sites can actually become quite distressing. So it's really important that people, once they start noticing those types of things happening, that they do actually give themselves a bit of a break, because the volume and quantity of information can be really, really hard to deal with. It's important that, we stay informed about what's going on in the world, but at the same time, we do actually give ourselves some space. So the first thing, of course, is making sure that when we're looking at news, that it's actually reputable, because, a lot of social media can spread some really horrific rumours that when people look under the surface of those rumours, it's not true. So I think the first thing is making sure that you're going to reliable news sites with reliable reporting. The other thing is making sure that if you've already clicked once and you found that a particular website was really overwhelming or difficult for you to go to, don't go back again. Just leave it be, give it some space, give it some time. If you're interested again, go back later, but give yourself some time. You don't have to constantly, update 2 seconds. I think that's one of the hard things, because we get so many updates all the time. There's this want to actually stay in touch with what's going on, but there's also that danger of becoming overwhelmed. So monitor yourself when you're doing that sort of thing. Just put your phone away, put it on silent, take your Apple or your other watch off and, just put it aside, just so that you've got some quiet time. And that could be going for a walk, that could be going for a swim, that could be just spending some time with family. Just, give yourself a break from the screens. And, if you're really not going so well, make sure you talk to other people who might be in that same situation, so that, it's good to know, because I think sometimes speaking with other people from your community or from people at work who might not have been in exactly the same situation, but may have had other similar situations that have happened to them, that can really help. But also we do have that Transcultural Mental Health Line that we spoke about a couple of weeks ago. And the really important thing is, if you're finding yourself in distress, you're not quite sure where to turn, do call that Transcultural Mental Health Line. It's there to help. It's on 1800 648 911, and they can help you. They're experienced clinicians and they understand your culture and your language. And we're also updating fact sheets at the moment. We've got this sort of information in Arabic, Kurdish, Kurmanji and Turkish, and soon to be available also in Assyrian.
Thank you, Dr. Jan. And thank you, Maria Casaniti, manager of the Transcultural Mental Health Center, who's also online and putting up some links. And there's information mental health called communities and the LGBTIQ page on the Transcultural Mental Health line. Dr. Gale, you've seen this during the last 3 years of COVID. You've been talking constantly with the population and community on information. How do we cope with there's chance for celebration, but there's also these distressing news that we hear every day.
Yeah, Jess, look, I think the advice that Dr. Jan just gave is really important. And I think that, whatever is happening in the world around us, and understandably for many people, especially if you've got a direct link where that's something that's directly affecting your family or your community, it's very hard to separate yourself from that. But I think for no matter what's happening in the world around us, that ability to self-care and look after your own physical and mental well-being is very important, because if we don't take that time and look after ourselves, then we're not going to be the best for other people and to support those people around us, whether that's our family here in Australia with us or our family overseas. So we need to be in the best state ourselves to be able to support other people, and taking that time out for ourselves to look after our own physical well-being and our own mental well-being is very important. And that's the case whether we face stresses such as the times that COVID gave us, or different kind of stresses such as what we might face now if we are people affected by the terrible situation in Turkey and Syria at the present, or anything else happening around the world. So taking that time out for ourselves. And as Dr. Jan advised, our physical well-being, we know that exercise helps improve our mental state. So going for a walk, looking at any kind of physical activity that works for you. That might be yoga, that might be going for a jog, might be going for a swim. Whatever suits you, find something that you enjoy and that works for you. And similarly, your own time for a quiet mental state. Mindfulness is a very useful activity, and we do have resources available to the community around mindfulness, including in some different languages. They're available, and that's a very useful practice. I try it myself. I'm not very good at it yet, but I still continue to try. And there is good scientific evidence about mindfulness as a practice and meditation to help us in relieving mental distress and keeping us focused in other aspects of our lives. So it's very important to look at things we can do for our physical well-being as well as our mental well-being. And even if we're not that good at it, like I myself, I don't manage to achieve, physical activity every day as I'd like to. But the important thing is that we keep trying. Every day we keep trying for our physical well-being and for our mental well-being. So that's very important.
Yes, thank you so much, Dr. Gale. And you're right about just getting out, even if if you have a pet, if you have a dog, or go out. If you don't have one, then catch up with a friend or someone you trust. It's one of those things that we discussed before, that it has been. We are able to see our friends now and our family, which has been different. Sometimes I myself feel like I just attended a face-to-face event today, and it felt a bit strange that we're all in one room when for so long we've been seeing each other online. And how do you cope with those changes sometimes?
And I think that's something that a lot of people have either jumped back into, and they're just so glad that things are back to normal. And there's a lot of people who are kind of a bit more hesitant. And there's a lot of people who are feeling excluded because they're still really worried about, getting COVID or getting other things. So I think we do just need to be patient. And, one of the things that we've often spoken about is looking around to see who isn't there, who we used to know, who we used to see at these types of events, and reaching out to them to see that they're okay. Because I think that's one of the things is, some of our social networks may have become a bit stretched or frayed during COVID, and trying to weave those back together is a really important part of community. And of course, we've also got a lot of people who lived in Australia for quite some time, have been overseas for a couple of years, not able to come and go. And so, again, weaving them back into our social fabric is really important for their health and also for ours, because it's just so great to be back, being able to be with others again.
Yeah, and you said that also the dynamics have changed. You know, when you've seen your family after so many years, and if you both or you can't expect them to be the same, so you have to adjust. There's an adjustment period, and how do you? Sometimes it's very hard to just get back into things.
And I think that's about being patient, isn't it? Really, it's about having time for each other. It's about spending time to see why things may have changed for that person, you know, what life experiences they've had, that if we used, you know, to have seen people in physical, you know, if what we did was we caught up because we were walking in the same direction every day and we haven't walked in the same direction for 2 years, things can change a lot. And then it's just about taking that time to, you know, as I say, build that bridge back again, I think. But just be patient, because everyone's experiences of the last 2 or 3 years have been really, really different. For some people, it's been a wonderful experience. They've had time to be away from people. They've had time to pursue new interests. They've had exciting developments in their lives. And so, you know, it's actually been a period of growth and expansion. And for other people, it's been a really hard time where they've felt isolated and potentially neglected. And so trying to, again, make sure that those people feel supported to come back into our social lives and that they're valued and wanted is really important.
Thank you, Dr. Jan. And Dr. Gale, in terms of, we've just received, of course, the information. We're just trying to understand the census that we received in data. We understand now more than ever about health, because for the first time, questions about health have been asked in the census. And we understand also that the communities that, and when we're, you know, communicating with multicultural communities and for the media who's online, how do we address the issues and making sure that we're evidence-based and making sure that research is you know, taken in consideration.
Thanks, Jess. I think whenever we come to address health issues, and we've certainly learnt a lot from COVID, and we need to make sure that we don't forget those lessons that we've learnt through COVID collectively. I think it's always very important to bring what we know about the science and the evidence, and that's really important. And we have to do our best at communicating that to people, both the things that we know for sure and the things that we're very certain of in terms of what the science and the evidence tells us, and also the things that we are uncertain about or we're not sure, but what we do know, when we think we might know more, and based on what we do know, what we would advise people to do. So I think it's always important that we bring the evidence, we bring the science, and we communicate that in the best way that we can to people, both what we're very sure of and the things that we're not so sure of, but what we would advise. But we always have to bring the evidence and the science. That's one part of the equation. But we also have to really listen to the communities and what their needs are, what they want for their own lives, what information they would like, what's important to them. And that can be different for different communities for different reasons. And so while we have the science and the evidence, it's also very important that we spend time to listen to different communities, for all those reasons, and note that it's not going to be the same for all communities, and different communities are going to have different needs, different understandings, different expectations, and that as health services, no matter what the health issue is, we have to find ways to bring that discussion about the evidence and the science and marry that up with what the community understands, wants and expects. And I think that's one of the key things that we have to continue to do. And I think there's many ways that we can try to do it better, and we are certainly always trying to do better.
Yes, thank you, Dr. Gale. And I guess for those media, multicultural media who are online today, would love to hear your thoughts. Please put them in the chat. And also if there's anything that you'd like from us and more information, would love to be able to understand what your communities are saying to you as well. For us at the moment, there's also public health information that, aside from COVID, there's the Japanese encephalitis. There's also, although it's raining right now, there's the heat information. And how do we cope sometimes with so much information in our that's coming out every day, but beat the heat information is important, because although it's raining, it can get hot, very much hot tomorrow.
Yes. Look, I think that's one of the things that last summer was fairly mild. Thank goodness, seeing as we were stuck indoors for so much. But I think one of the things is making sure that we do reach out to people, that people understand that the hot weather, one of the biggest problems is not just how hot it can get during the day, but also the fact that it stays hot overnight, and that tends to cause more problems for people. So it's about staying hydrated. If you've got older friends or relatives and you happen to have air conditioning and they don't, it's a really good time to collect your family together where they can stay cool when it's one of those really hot days. Checking in on older neighbours and friends just to make sure that they're okay, because as we get older, our body's ability to self-regulate its temperature and respond decreases, which is why we're it's particularly important to check on older neighbours and friends. And of course, with sun safety, which, it sounds so boring because, a lot of us grew up now with wearing sunscreen, slip, slop, slap, but it does really remain important, and particularly because we've got some big events coming up this weekend and people will be out in the sun for quite some time. So it is worthwhile with the sunscreen. I'm not sure how well it mixes with the glitter, but I'm sure it'll work all right. And again, making sure that you've got, head coverings that work for you, and that if you can seek shade between the hours of 10 and 2, sometimes it can be a longer time. One of the really useful apps I have is the SunSmart app from the Cancer Council, which can actually tell you where you are in New South Wales, what hours that you really need to be particularly careful on a given day, and it'll just tell you each day. So it's a really useful app. But I think, again, it's that stay hydrated, stay out of the sun as much as you can, and wear sunscreen, cover up, wear a hat, put your shades on, and, just particularly, though, look after older people.
The shades would look good. And the glitter, but Dr. Gale, you have anything to add to that? I think you're right in terms of beat the humidity, isn't it?
Yes, I'm sure my hair would appreciate it. There's a bit much frizziness going on, but no, I think I completely agree with what Dr. Jan said about staying safe during our hotter days, and also to stay very well hydrated. We know sometimes people can easily forget to drink water, and water is really the best drink as well when it is hot. So don't forget to drink plenty of water as well on hot days and keep hydrated. And I think those messages are particularly important for many of our international visitors who may be here for WorldPride or just visiting Australia during our summertime to enjoy themselves. And I think sometimes our visitors from overseas who are not used to summertime and, what prolonged periods of heat can involve, sometimes I think don't recognise the importance of some of those measures. So particularly for any visitors from overseas who are here holidaying or visiting family and friends, very important for them as well to be aware of those messages, because it's perhaps not something that they're used to. So yeah, just a reminder to all of you who've got friends and family visiting or visiting yourselves to be extra vigilant.
And if you are staying in Sydney, but if you're going regional and there are some cases of Japanese encephalitis, you need to
cover up.
Cover up.
Particularly dawn and dusk, trying to stay with a long sleeve light shirt so that you've got less capacity for the mosquitoes to bite you, as well as using an appropriate mosquito repellent. So DEET is one of the ones. There's others as well, but really important that we try and avoid getting bitten. And if we are in Western New South Wales, Southwestern New South Wales on a regular basis, fishing, outdoor activities, cleaning up after the floods that we've had previously, really important that we do get vaccinated against JEB, and that vaccine again is also available from pharmacists and GPs.
Thank you. Well, we've run out of time, but thank you so much, Dr. Gale, for joining us. Any last words for Multicultural Media and to push any more messages?
Oh, look, I just want to wish everybody a very happy WorldPride season, and look forward to seeing people out and about at some of the events. And please stay safe and have a great time.
Stay hydrated, because it's going to be a fun celebration. And it's so lovely to see you. And thanks for joining us this afternoon. And Dr. Jan, any last messages?
No, just hope everyone's having a wonderful time. Hopefully the weather will be a bit kinder as far as people who want to be out and about. And happy WorldPride.
Thank you so much, Dr. Jan. And thank you for joining us this afternoon. We'll be back next fortnight with more information. And if you have any topics that you'd like us to feature, please let us know and we'll try to get the resources to you in language and links to you. We'll get this recording sent to you through your email, and also it would be available on our Multicultural Health Communication Service website and our social channels. Thank you again for joining us. I'm Jesusa Helaratne with Dr. Jan and Dr. Gale with us today. Have a great day and enjoy the weekend.